Good afternoon. I'm Steve Noviello. The nurse who studied in Arlington and was quarantined in the Northeast after working in West Africa with Ebola patients is being released today. The New Jersey Health Department says Casey Hickox has been symptom-free for 24 hours. She said that while in isolation, she was living in a tent outside with no shower, no flushable toilet, no air conditioning or heat. Hickox will be taken on a private carrier plane to Maine, where she lives now. Fox's Peter Ducey has more from Washington.
A Maine nurse who had been quarantined in a New Jersey hospital is now being discharged after being detained at Newark Liberty International Airport last week. Casey Hickox, who was working in Sierra Leone before returning to the U.S. Friday, was taken into isolation despite showing no symptoms of Ebola, in accordance with a new state policy which calls for a mandatory 21-day quarantine of any medical worker who had contact with Ebola patients overseas.
We think that the policy is overly broad.
Hickox's release comes one day after New York announced changes to their 3-day-old mandate, which also called for a mandatory 21-day quarantine. Now, returning workers are being asked to remain in their homes during the incubation period.
We're trying to balance aid to West Africa and protection and the public health of New Yorkers.
Last week, 4 states announced mandatory quarantines, drawing criticism from the White House and health officials as being counterproductive and saying it could actually hurt the effort to stop the spread of the virus.
If we don't have our people volunteering to go over there, then you're going to have other countries are not going to do it, and then the epidemic will continue to roar.
Private transportation is being arranged to return Hickox to her home state of Maine. According to a statement from the New Jersey Department of Health, officials in Maine have been notified of her arrangements, and they will determine what steps, if any, to take next. In Washington, Peter Ducey, Fox News.
A New York hospital is testing a 5-year-old boy for Ebola. He and his family returned this weekend from the Ebola hot zone in West Africa. He did begin showing symptoms last night, including a 103-degree fever and vomiting. His family is reportedly quarantined in their apartment. Meanwhile, the New York City doctor battling Ebola got plasma from survivor Nancy Wright-Bull. Wright-Bull and Dr. Ken Brantley contracted the virus in Liberia. They were the first Americans treated in the U.S., both successfully. Dr. Spencer treated Ebola patients in Africa. He is in serious condition in a New York hospital. The Pentagon says dozens of Army soldiers and their 2-star general are being isolated at their base in Italy after they returned from serving in West Africa to help with the Ebola fight. They will be restricted in an isolated location and will not be allowed to go to their homes for 21 days. Several dozen more are returning in the coming days and will also be isolated. There was no exposure incident which triggered the decision, but they will be checked regularly for any kind of Ebola symptoms. The Ebola epidemic in West Africa is not slowing down. Today, the World Health Organization confirmed the number of reported cases have exceeded the 10,000 mark.
We know that not every case is being registered, and one of the reasons is because we still do not have enough of beds. So many people stay in their communities, stay at homes, they die there, and they are not necessarily including in this tally. It's difficult to say how much this figure should be, but again, we know that there are more people out there being infected than what is being reported.
The number of deaths is now at 5,000.